Good afternoon and welcome to the National Hispanic Council on Aging's webinar, Caring for a Loved One During the Pandemic. My name is Christina Pacheco and I am NHCOA's Director of Resource Development and Policy. It is my pleasure to moderate today's webinar. Due to the ongoing COVID-19 pandemic, NHCOA continues developing innovative ways to engage, inform, and listen to the communities we serve. For 52 years now, NHCOA has worked to improve the lives of Hispanic older adults, their families, and caregivers. Even during a pandemic, we continue to work towards our mission. In partnership with the John A. Hartford Foundation and the Diverse Elders Coalition, this COVID-19 webinar focuses on caregiving during the pandemic. Today, it is my pleasure to welcome a panel of experts that will highlight long-distance caregiving, how caregiving differs between the United States and other Latin American countries, and resources that are available for caregivers during this pandemic. Nearly 43.5 million adults in the United States are unpaid caregivers for a friend or family member. These family caregivers provide crucial health services to family members and friends and are considered by many to be frontline health service providers. During this pandemic, they have assisted with alleviating much of the stress on an already taxed healthcare system. Before we get started, let's pause to thank our sponsors, as this webinar would not be possible without their generous support. Thank you, John A. Hartford Foundation, Diverse Elders Coalition, the National Alliance on Caregiving, Lilly, AbbVie, Pharma, the CDC Foundation, United Healthcare, and Pfizer Foundation. To begin the webinar, it is my pleasure to introduce the President and CEO of the National Hispanic Council on Aging, Dr. Yanira Cruz. She is one of the nation's foremost advocates and spokespersons for diverse older adults and is nationally recognized for her commitment and leadership on behalf of diverse older adults. Today, Dr. Cruz will provide welcoming remarks. Welcome, Dr. Cruz.
Thank you, Christina. Thank you so much, and good afternoon, everyone. Buenas tardes. It's truly great to be here, and I thank you for joining us as well. I hope each one of you is well and staying healthy. We are officially 1 year into the COVID-19 pandemic, and hundreds of thousands of lives have been lost throughout the country, and millions more have died across the world. The coronavirus is the greatest threat of our time to our health, the global economy, as well as for caregivers. It really spares no one. COVID-19 has disproportionately affected Hispanic communities and their caregivers. Family caregivers are playing a vital role during the pandemic, but we must also ensure their well-being in these challenging times. We have talked to Latino caregivers during this time, and they have expressed emotional and economic stress and decreased routine healthcare options for themselves. Caregivers not only have to protect their loved ones from COVID-19, but they also must protect themselves to ensure that they can continue to care for their loved ones and to ensure they will not pass on the dangerous COVID-19 virus. During the pandemic, caregiver burnout is at an all-time high. While many communities offer support services for family caregivers, many of these resources are stretched thin or have been cut because of the pandemic, leaving the caregivers on the brink of burned out. It is critically important to find solutions to ensure they receive the support they need to care for their loved ones during the pandemic. And so today we will hear from experts on long-distance caregiving, how caregiving differs between the United States and Latin America, and resources that are available for caregivers during the pandemic. And one way we are helping our older adults, their families, and caregivers is through NHCOA's multilingual helpline that is assisting with enrolling people to get the COVID vaccine in their respective communities. This helpline is an opportunity to inform and empower Latinos with accurate information and resources to stay healthy during the pandemic. We are working to get timely and reliable information in 3 languages, Spanish, English, and Portuguese. The helpline will be available for up-to-date, scientifically based information, current safety guidelines, information about safety and effectiveness of the vaccine. We know that's been a big concern among many of our community. Addressing myths and facts about the virus and the vaccine. We know that one of the barriers to accessing the vaccine for older adults and persons with disabilities has been transportation. Through the helpline, in partnership with Lyft, we will offer transportation to and from the vaccine appointments. So we encourage you to visit NHCOA's social media platforms for more information about this new initiative. We continue to support family caregivers through our caregiving training. NHCOA's webinars will continue to focus on empowering caregivers and with a special emphasis on dealing during this pandemic. And we will continue to advocate for policies that benefit and support Latino older adults, their families and caregivers, and raise awareness of legislation that has already passed, such as the CARES Act. And also in partnership with the Diverse Elders Coalition, we will also continue to address unmet family caregiving needs among all diverse older communities. And lastly, I invite you to stay connected to us. Get vaccinated as soon as you can, and feel free to send persons our way who need help registering for the coronavirus vaccine. We look forward to continuing to work to improve the lives of Hispanic older adults, their families, and caregivers. Together, we can make a difference in the lives of caregivers and older adults. Muchísimas gracias and enjoy the rest of the webinar.
Thank you, Dr. Cruz. Throughout this webinar, we will have polls in which we hope that you, as our participants, can all participate in and provide your answers. Let's start with the first question. We will provide you all a minute or so to complete the poll. The first poll is, what have been your biggest challenges as a caregiver related to COVID-19? This will be a check all that apply, and it will have 2 parts given the limitations of the answer choices that are provided. So if none of those options worked for you, or if you had additional challenges that you faced as a caregiver, we ask that you share those in the chat box. This shows you what the responses were from our participants. It looked like anxiety and isolation were pretty large for the caregivers that we have with us. Access to services and financial strain and job loss were also considerations as well. Our second question is, what positive outcomes, if any, did you experience during the pandemic? Again, this is a select all that apply, and we will provide you a minute to complete it. This also has a second piece to it. So if none of these apply, you'll be able to select that in the second part of it. Again, if you faced or found other positive outcomes from experiencing the pandemic, we ask that you put your answers in the chat box if you select other. Thank you for participating. Caring for a loved one is no small task. Absent a pandemic, caregiving causes stress and depression. Caregiving can also affect a caregiver's emotional well-being, finances, and routine, including their social activities. Most family caregivers often feel unprepared for their roles. During a pandemic, caring for a loved one brings a whole new set of challenges. Let's welcome our first speaker, Pedro Lima, the property manager of Casa Iris Housing Facility in Washington, D.C., and our programs associate at the National Hispanic Council on Aging, the leading national organization working to improve the lives of Hispanic older adults, their families, and caregivers. Before joining NHCOA, Mr. Lima lived in Brazil, where he graduated in business administration from the University of Belo Horizonte. Mr. Lima is a millennial who took care of his grandmother while studying and working. As a result, his commitment to supporting older adults and those in need has blossomed. Today, Pedro will provide a caregiver perspective about his experience with long-distance caregiving. Welcome, Pedro.
Thank you, Christina, and good afternoon, everyone. It's a pleasure to me having the chance of giving my testimony on today's event, because I'm sure doing this, I will be representing so many family caregivers around the world. First, I must thank NHCOA for giving a voice to so many important issues and struggles that many have had through the pandemic. The reality is one, being a family caregiver is not an easy job. Now, imagine during quarantine when the person who needs the most care is the most affected by the virus in case of an infection, and consequently requires extra caution to perform the simplest everyday activities. I will give you a little background. When I was 10, my grandmother from my dad's side was diagnosed with pulmonary fibrosis. It's a degenerative disease with no cure. It was a significant impact in the whole family, mainly because the doctor gave her few months to live, at most 1 year of life left. My parents end up being honest with me at the moment, despite my young age, because they wanted me to understand a little more about death, and because they wanted me to spend as much time as possible with my grandmother. At that time, I did not live with her, but all the grandchild used to go to her house on the weekends. But please, don't think it was a good thing going almost every weekend to her house. It was actually a wonderful time because we were all the cousins there, most with the same age range. And besides doing company to our grandma, we also had a lot of fun. I still remember Christmas that year. I have never seen her house with so many family members in my life. At the end of the night, everybody was crying because we thought that was the last Christmas with her. But I will give you a little spoiler. It was not the last one. In the early stage of her illness, when she was diagnosed, my grandmother was fine. She still did most of the things on her own and rarely asked for any help. After time went by, she hired a caregiver to help her with some daily tasks and keep her company during the week. On weekends, she refused to get any help from outsiders, even in the most challenging moments. This was the moment she wanted exclusively for the family. There was when I started to become a family caregiver without even knowing it. Due to the complications of her disease, she had to use oxygen, which began to be administered only when she went for walks or when she would work on her garden in the backyard. But over time, the frequency increased as the disease progressed, and she needed the oxygen with more frequency. Performing simple tasks was no longer so easy. We took turns among the cousins to help her with her needs. She had a hustler like the one Christina has, and she played. One of us would go to her no matter what. Um, so her needs went ranged from getting a glass of water to helping to get out of bed, an activity that has become increasingly difficult because of her tiredness. Believe me, it was a fight to know who would help her with something, who was grandma's favorite child, who did things faster. It was enjoyable for all of us. I made the best soup with cheese, and it was a pride for me when she asked me to do it, usually on Sunday nights. I'm not going to lie, I bragged a lot to my cousins about having this best soup. More years passed and she got a point where she needed oxygen 24/7 on the maximum level, so she was getting more tired every day until she could not resist anymore and passed away when I was 15. I can guarantee it was 5 years of a lot of resistance and learning. This process made me a better human being. Currently, I only have my grandmother from my mom's side, and thanks to God, she's very healthy at the age of 84. My whole family is in Brazil, so I followed some movements of the pandemic first because we are affected here in the US a little before Brazil. At first, I was flagging them about the importance of taking care, keeping my family informed of everything that was happening here so that they could take care in advance, such as importance of having face masks, hand sanitizers, and other cleaning supplies in stock at home. Our biggest concern, besides the virus, was with her loneliness and the need of going to the supermarket because she lives alone. One of my uncles decided to move in so he could help her into the day-to-day functions and buy the household supplies. So just imagine a person like my grandmother. Uh, until then, she was very active. She was always doing something at someone's house, visiting family members, playing cards with her neighbors. Then she faced a new reality, which you can no longer go out, and visiting family members has become something out of the question. At that point, we decided to give her a smartphone to receive video calls and stay closer to her loved ones. With great care and protection, some cousins and my uncle taught her basic functions such as receiving and making video calls from that phone. I started to call her almost every day during the lockdown. At first, I noticed that she was very tired and bored enough to stay at home. When my family and I agreed that we would always have someone contacting her during different hours of the day, she confided to me that few times that it helped her a lot to get rid of problems and with the feeling of loneliness. This inspired me to create a community help network. This is how I call it. But this is where I encourage my grandmother to call her friends and consequently encourage them to also call other friends or family members. Another idea we had with my family was going to shopping for the neighbors on the street for those who live alone. My grandmother lives in the same neighborhood since I was born. Consequently, everyone knows each other. The idea was this. My grandmother and her friends communicated over the phone, and share what they were looking to buy on that week. Each week we had a designated house where the kids or grandkids or friends or volunteers were responsible for that house. This person goes to the supermarket with the shopping list of the homes of the block and in the same street, right? And bought everything for everyone. And so it happens every week with the other house. That idea kept them supplied with all the supplies needed to live with dignity. So all of them would have something every week. As many of you know, I'm also the manager of Caregiver's building. There's a building located in Washington, D.C. It's an NHCOA affordable housing where low-income older adults live. During the pandemic, we had the same concern here as we wanted to avoid as much as possible their way to shopping during the quarantine. So initially, we got a group of volunteers who went to supermarket and pharmacy for them. After a while, we managed to get consistent donation of food boxes, which now comes every 15 days and is enough to keep most of them supplied with food during the pandemic. Another major concern was regarding testing and now the vaccination. We had some case of COVID here at the beginning of the pandemic in April, and it wasn't easy to carry all these mass tests. Still, with a lot of efforts from our team, we managed to quarantine the building and carry out the mass tests, where it was possible to locate 4 people positive for the virus in addition to others who had already been hospitalized. Fortunately, we had no one died here in this building, and we are able to attest the importance of mass testing to avoid the community spread among the residents. The partnership with other local entities, the support of municipal government, and mainly of volunteers was essential so that we could together face the pandemic and the severe quarantine that we had in the city of DC. I will repeat it. Today, a significant concern is with the depression and the loneliness that each one of them older adults felt during this pandemic. So thanks to the union of volunteers and friends of the organization, with the consent of the older adults, we shared the phone numbers for those interested to call. So it was possible to have a very fruitful exchange for everyone. The people who called absorbed the experience of life and wisdom of the older adults, and that helped the older adults with the feeling of loneliness and could share a good time with people who, however unknown, listened to them, remind them of necessary remedies, of medicines, and kept them some company every day. This same group helped us to enroll every resident to get the COVID-19 vaccine. And now we're glad we can say that everyone got at least 1 dose of the vaccine. That also inspired us here at NHCOA to create that hotline that was mentioned today, right now, by Dr. Cruz. That made us hope for better days very soon again, and hopefully we can help thousands of people with this hotline with vaccine registrations. I also hope and inspire you today to call for a loved one that you think may be suffering from loneliness and make their day happier. I will now turn back to our great moderator, Christina Pacheco. Thank you everyone for listening to me.
Thank you, Pedro, for your passion and your work. Your dedication to your grandmother and the older adults at Necessities is truly inspiring. Caring for loved ones during a pandemic is extremely challenging. I quickly learned that I needed to call my parents' house phone as opposed to their cell phones to ensure they were abiding by quarantine guidelines, which were very difficult for them, as my dad in particular is very independent and insists on doing things for himself, regardless of the risks that they may bring during a pandemic. We'll take a brief pause again to ask another poll question. Poll number 3. Which of these are a concern for you at this time? Again, this will be a 2-part question. So if there are other considerations or you are not concerned, those will appear in the other, in the next question. You have about 15 more seconds before we put up additional options. Again, if you select the other, please add that information into the chat box if you are comfortable. Okay, and as you can see, the most popular concern was taking care of myself emotionally, and that was closely followed by preparing for future care of a loved one and keeping myself and those close to me from getting sick. We have one additional question. Which services do you currently not receive, but you would think would be helpful if you could receive them? There will be additional options available in 60 seconds. Thank you for your participation. As you can see, emotional support was the most prevalent answer, as well as financial help. Being a caregiver to a loved one is an incredibly rewarding experience, yet it is often also a challenging one. For some, the COVID-19 pandemic has made the role of caretaker even more complicated, as we know that the coronavirus will be living among us for some time. It's a fact that COVID-19 has changed our way of life and the way that we interact, due in large part to its quick ability to spread and devastating effects on many who are infected. Anyone can become infected with the new coronavirus, but some people are more susceptible to developing severe symptoms or complications as a result of infection. These include older adults and those living with chronic disease. Public health leaders are advising these more vulnerable individuals to take precautions to reduce their risk of getting sick with COVID-19. These precautions include wearing a mask that covers both your nose and mouth, staying at home, and away from other people as much as possible, even as statewide restrictions are lifted. As a result, this will continue to present unique challenges if you are a caretaker of someone who is at high risk. But let's hear more from our next speaker, Ms. C. Grace Whiting. Ms. Whiting is the President and CEO of the National Alliance for Caregiving, a Washington, D.C. based coalition that builds partnerships in research, advocacy, and innovation to make life better for family caregivers. You can learn more about the National Alliance for Caregiving's work at caregiving.org. Welcome, Ms. Whiting.
Thank you so much. I am so happy to be here with you guys and to be spending some time this afternoon. And I'm just going to talk a couple of minutes about understanding the impact on those friends and family members who are supporting us. And you can see on this first page, we've been doing some work with groups such as NHCOA and other members of the Diverse Elders Coalition around profiling caregivers who will be featured in a report to the U.S. Congress. And this is an example of one of those profiles where you can see name is talking about, I will walk a fine line since I'm expected to be a sister, a daughter, a caregiver, and the family communicator. I agonize over what's going to happen when my parents are gone, and I know I will be my siblings' caregiver for life. So we look at caregiving issues all across the lifespan. And on the next slide, just to give you a little bit of context around what it is we mean when we say caregiver. So there's so many different ways that we can talk about this, but typically we mean an adult family member or other individual. So a friend, a neighbor, someone down the street who has a significant relationship with and who provides a broad range of assistance to someone who has a chronic or other healthcare need, a disability, or a functional limitation. Now, I'm sure all of you know that families come in different shapes and sizes, different orientations, different arrangements, some near, some far. And this is not a perfect definition, but it is the definition that is in the Raise Family Caregivers Act, which is the new law that was passed just a couple years ago to get Congress and our nation together on a plan for caregivers. So you can get a sense of people starting to think about what does it mean to care for someone. One other thing I'll note is we do work with folks from around the world, and we do work with diverse populations of caregivers in the US. And not everyone is comfortable using that word caregiver. For so many of us, caring for someone is just something we would do anyways for someone we love, whether it's a parent or a sibling or a friend. And because of that, it can sometimes be challenging for people to find the supports that they need. So I'm going to talk just a little bit about some of the research that we know is out there because of COVID. And then I'm going to tell you what we're thinking about and how you can get engaged in helping us to solve some of those information gaps when you just cannot find what you're looking for. So on the next slide, I want to talk about one of the 3 big studies. So, you know, and as we're sitting here with our afternoon coffee or tea, I'm just thinking we're big data nerds over at NAC, and we love looking at all the numbers. But to keep in mind that none of these numbers represent all people. So these are snapshots of different groups of caregivers in time. And this is from the University of Pittsburgh. And they asked the question of not just how has COVID impacted family caregivers, but how has it impacted family caregivers compared to non-caregivers or to people who don't currently have that responsibility. And you can see on the left-hand side here a wheel that talks about just an increase of caregiver responsibilities, just more emotional difficulty in caring for someone, and an increase in mental health issues. And you can see sort of it goes from sort of most likely impact that people reported to least likely. But on the right-hand side, this is the part that I think is really important for people to remember is as much as the pandemic has been hard for all of us, not being able to go to our faith communities or visit family or shop for groceries regularly at the grocery store, or having fear or even a sense of loss from what we've missed out on, not to mention people who have been personally impacted by COVID. All of us are dealing with those kinds of pressures, but those pressures are especially high among people who are caregivers and who are taking that on. And you can see that on the right-hand side, the sleep problems, anxiety, and depression that weighs heavily on caregivers. On the next slide, you'll see kind of another snapshot on this. And I wanted to zoom in here a bit on the idea of crisis and worry, because, you know, we talk about emotional strain, but what does that actually mean in terms of our behavior? So you can see here that caregivers have had a lot of worries, particularly early on in the crisis, that someone in their family would be denied care, that they may lose financial supports, or that somebody will get very sick. And on the next slide, there's a breakdown of these types of worries. So you can see on the left-hand side, these are the types of behavior changes people made because they were worried. So for example, you can see everybody's been washing our hands more. We all had those songs where we were like learning to rewash our hands. And so everybody is experiencing that. But there are places where caregivers, the impact of worry on them was different. And one was stockpiling food and water. You can see a breakout of that there. Postponing travel and work and school activities. And you were way less likely to visit a doctor because of that fear that you might accidentally bring something home or put someone at risk, and much more likely to cancel a doctor appointment. And you can also see over here to the right-hand side, those fears about not being able to buy food, to get nutritious food, sometimes worrying you would run out of food, something that, you know, is a really basic human need. On the next slide, we pulled data from another study that has come out in the last year on caregiving and around the world. And this group, Embracing Carers, is a network of different caregiving non-governmental organizations. And they likewise found that pressure on basic necessities is one of the big changes that we've seen in COVID-19. Most caregivers in this study said that the pandemic actually made their financial health worse. And when we break that down and try to understand where are those financial pressures coming from, you can see more money going to supplies and resources, including food, not having the kind of government support that you might normally have, and then having a change in your work, whether that's a reduction in salary, being furloughed, having your hours cut. Those types of economic pressures coincided with the pandemic and made it very difficult for a lot of families to respond. On the next slide, this Embracing Carers study gets into the challenges facing women. And I raise this because in many communities, women are the matriarchs, the foundations of our families. Now, there are, of course, men who take on care responsibilities. And sometimes men care in different ways than women care. But for the pandemic, particularly for women in Latin and Hispanic communities, they have had that much more to take on. And you can see here sort of this sense of women in general having to take on more care responsibilities during the peak of the pandemic and now, and women spending more money on food. So if you'll skip to the next slide. And this is just, again, more on the supports that people didn't have access to because of the pandemic. Now, enough with the numbers. Let's go to the next slide because I want to leave you with a happy note. And that is, there's a lot of momentum around caregiving. The president has a plan and support in his infrastructure program. We see people like Melinda Gates speaking out of it. And there's a new report on the national horizon. And on the next slide, you'll see something that we've been doing to sort of build this out is to really build an initiative, a caregiving library, where it's easier to find information. Let's just take a peek at the next slide. And you can see in this library, one of the things we're trying to do is map what are those pressure points for caregivers during crisis. And this map was created with insights from people in our caregiving town halls, our national work with global partners, with people who are researchers and business folks and all over. And if you look on the very last slide, you'll see we've also started to think about what are the solutions. So how do we put a roof over the head of the caregiver that's sitting under this cloud? So if these are the kinds of challenges we know that people are facing during crisis, if you look at that last slide, you'll see some of the things we think could help those caregivers. And I think part of this too that we made sure to call out is just the impact of institutional racism and other discrimination that has really come front and center as we were dealing with the pandemic. We were dealing with these healthcare issues and all that. So I don't know if it's possible just to show that last slide. So we'd love your feedback on this, and you can go to the website, you can learn more about the work we're doing here, and you can also submit resources that you've created for your community that might be helpful to other people who are caregiving. Thank you so much.
Thank you so much, Ms. Whiting. I want to remind all of our attendees that if you have any questions or comments for our presenters, please type them in the chat box and we'll address as many of your questions as possible during our question and answer session. Before introducing our next panelist, we have another question. For those of you who are long distance caregivers, what would make connecting with persons who you are caring for easier? Again, this is a select all that apply. And there will be additional options in 60 seconds.
Y cuando salga la cámara.
Okay, there's about 15 more seconds. And then we will have the second part of that question. Again, please feel free to participate in this piece as well. We'll give you about 60 seconds. Same question, just additional response categories. Okay, thank you for participating. As you can see, for those of you who identify as long distance caregivers, it would be easier to connect with loved ones virtually, as well as finding cheaper ways to provide care during the pandemic. Thank you for participating in our question. In Latin America and the Caribbean, there are more than 16 million positive cases of COVID-19. South America is the region of Latin America with the highest concentration of cases, with Brazil leading the count with nearly 13 million positive cases, followed by Colombia with 2.45 million cases and Argentina with 2.39 million cases. The cases triggered by COVID-19 are generating social and economic consequences for all people, including caregivers. The global pandemic resulted in many countries applying a lockdown, closing businesses, schools, universities, theaters, and implementing restrictions such as staying at home and avoiding visiting family or friends that are not a part of your household. These restrictions aim to protect all people, particularly those most susceptible to the virus. However, in an effort to protect the most vulnerable populations, such as older adults, these restrictions created physical, social, and emotional challenges for older adults and their caregivers. Let's welcome our next speaker, Ms. Olga Miranda, a producer and host of her own television show, Olga and Olga Plus. Influencer, recognized chef from El Salvador, and awarded Chef of the Year in 2017. She is the founder and president of the Salvadoran Foundation for the Elderly, FUSASTE, since 1990. She is the Territorial Vice President of the Hispanic American Organization for the Elderly. The foundation received a special recognition from the Legislative Assembly of the Republic of El Salvador for its excellent work and dedication to the elderly in 2018. Today, Ms. Miranda will provide an overview of caregiving in Latin America, particularly in El Salvador. Welcome, Miranda.
Thank you. Thank you so much, and thank you for the presentation and for inviting us. First of all, I want to say that my English is a little bit rusty on this kind of subject, but I'll do my best, and I'm more honored to be with you. I won't do a brief of Latin American countries. I will talk about our country, El Salvador, which is a very little country in Central America with a big population, over 7 million people, and we only 21 square meters. So it's a very little country with lots of people, and 7,000 of them are elderly people, and most of them are in kind of poverty. We're a third world country. We don't have all those knowledges and all those facilities that other countries, especially for first world, have. We found FOSATE, which is the Elderly Foundation, the third elderly foundation. That's how we called it at that time, because we didn't know that third H, it was not only third H, it was fourth and fifth and whatever we know now. But it's a nonprofit organization. It's a private organization, and we almost have all the responsibility of the elderly in this country. For the first time in 31 years, we are going to have now especially subside from the Minister of Health, that finally we're going to have a little bit of money and a little bit enough to work with our programs. Up to this time, we've been working with our funds, just doing alliance with people with special business, inventing and being very creative to maintain our organization. Our organization holds 1,018 almost members. We have 8 home daycare centers around, spread in different cities. We have 2 night shelters, and we work with filials and subfilials around the 14 departments of El Salvador. We have 119 board of directors, and the other staff, other people works as a voluntary. They don't earn any salary, only the main office and the people that works directly with the home daycare centers and the 2 homeless stores that we have. But with COVID, we started, and we were very successful, and we worked a lot, and I think we did more than we were expecting, or people was waiting for us. We start with time. When we heard that already in Spain and in Italy, people was getting sick, we knew it was going to come to this part of the world. We were sure. So we had a meeting on the end of January, and we started talking about COVID and finding out about this pandemic. And when I say we have a meeting, it was with all our directors. Some of them are doctors, only 2. The other ones are people that we have prepared. And we're the directors of the home daycare centers and staff of our office. And they were a little bit like saying that we were it's not time to talk about this subject. But we insist, and we made a plan, an A, a B, and a C, of how we were going to attend our people when they would come for the day, what we were going to expect, and we started thinking about asking the mask and some different things. Never thought that we were going to close down so fast. In February, at the end, when we heard that in Costa Rica it was already COVID and as pandemic was starting, we sent home all our elderly that they were going to the different home daycare centers that we had. We prepare them. We give a lot of, we talk to them. We explain them what was coming on. We begged them to stay at home. We gave them alcohol, and we gave them masks, and we gave them a little bit of food. I say a little bit because our government closed the country in March, and it was closed up to September, completely closed. You had to have a permission to go to the store or to go to the supermarket. You were not allowed. Only 1 or 2 persons during the week. You could go 1 or 2 days in the week to do your grocery, or if you need medicines, or you could ask them. It was only the supermarket open, Dollar City that I called that. It was like going to a mall, and the market. That was the only things. Oh, and well, sure, drugstores. Everything else, it was completely shut down. And we were an organization that we used to have very good relations with people that was working, producing, and they would give us some funds every month, and we lost them. We lost contact with them. So we did alliance with different foundations, with 3 of them. One Mesayao and another Crete Foundation and another one. And they start raising funds, and we use a lot Instagram, and we design a campaign, and we alert people, and it worked. People really, and we were in the phone, and we start raising funds, and we raised like $54,000. And with that, we buy ahead before that everything was closed. We bought the basic things like rice and beans and coffee and flour and things to do tortillas. That's one of our basic meals. And we bought them before because they started closing. You couldn't circulate from one department to another department, to one state to the other state. They were closed. So we did on time on a good price too, before prices would go higher. And we hold all those things, and we start packing. And how did we pack? We use our locations, our different daycare centers. Some of them are a little bit big. They can hold almost 800, 900 persons, another one 200 persons, another one 150, another one 50. But we had enough space, and the same elderly, some of the ones that were not so old, came and did the bags. And then we rent trucks, and we went around the whole country, and we give food to 5,000 persons for 2 months. We thought that was going to be enough. Never. We thought that it was going to be so much time closed. But we've been giving them food, not so much like before, but we just did our last distribution this month. We've been always giving to 5,000, and to our people that used to go to the home daycare centers. Those people, most of them, were eating from us. They were hardly maybe have some eggs for dinner or some beans for breakfast, and they were depending on us to eat. So they have struggled. They really have passed bad times, but I think that we kind of helped them a lot. We gave them medicines, basic medicines too. We make an alliance with 2 labs, and we gave like $70 on a bag of medicines, and we have done that like for 3 times. And this is that situation when we gave food. And then we decided that we had to pick up the people from the streets. So we started giving exams. We picked them up. We rent places where they could sleep, because we didn't know if they had COVID, and we couldn't take them to our home, not to our albergues. We did temporary places. We bought everything: beds, refrigerator, kitchen, everything. Our staff, we never fire anybody. That staff, we bring it to take care of the homeless. And this homeless now, they're really living with us. We closed them. We shut them down. We didn't allow them to go out. That was difficult because there was people that was not accustomed. They had different way of living, and they learned. It took us hard. We had to do regulations for them to behaviors, but now they have their free medicines, free clothes, free beds, 3 meals, completely meals, 2 extra meals, and then they learn emotionally, some of them were really struggling. So we had to give them a lot of things to do, different things for therapy, the gymnasia. We didn't have in some of them enough place because they were only to have beds, and we had to make them like a home. But we did it, and our health and our staff, incredible, impressive. I will never gonna forget how our staff have behaved. They worked extra hours. We had to rent cars and taxis to bring our staff in different places because they couldn't go on public transportation. There was not any public transportation, and we didn't in any way expose them. We had people with COVID from the streets they would pick up, and some of them died. I can say they died, 7 of them, and in a different places of us. But we take 56 out of COVID, which is a very success thing. Alone, us. We had this very famous doctor, Barrientos, Marilena Barrientos, very well known, especially in Europe. And she gave us through Zoom a whole morning of how to treat them during the pandemic and what kind of medicines to give and what protocol to use. And we use her protocol all the time. And they were starting just to cough, and we would go really fast and do the whole protocol of thing. And we had oxygen, we rent oxygen, we were prepared, and we really went through the pandemic. We did even better than the nursery homes run by the governor. Nursery homes run by the governor, a lot of people died. From one place that they had like 190, it died like 80%. So it was really bad. So we feel we did really good for being what we are, for being a nonprofit organization, for not receiving from any other country's help or any organization. We all know that once they work with elderly, that it doesn't exist that kind of help with money for funds. So we're happy now that we can keep on. We learn a lot with experience. We start going to homes. After we pick the people from the street and the homeless, we start finding out about homes. Homes, most of them run by religious people that they couldn't go and ask for money. Everything was closed. Like, for example, Mother Teresa de Calcutta, they're not allowed the nuns to go and ask for money. So we are monthly taking food to them and medicines, and we do that with another elderly homes, very poor. And now then we start visiting elderly at their houses that they were alone and they didn't have any help. So I think this is the most important thing that I want to share. We are an undeveloped country, but I think with God and with the help we got and with the enthusiastic and devotion of our people, we made it. We went through, and we are still working. Thank you for your attention.
Thank you so much, Ms. Miranda. Our next question, where do you get access to services? Again, this is a select all that apply, and we will have additional responses after 60 seconds. Ten more seconds before we provide additional options. Again, if you select other, please, if you're comfortable, provide what other service or where else you access services in the chat box. 10 more seconds, and then we will review the results. It looks like the vast majority of folks are seeking services from friends and family as well as healthcare providers. And then do we have the second part of our results? It also looks like folks are turning to nonprofit organizations as well. Thank you. So there's a saying that goes, it's hard to believe it until it happens to you. But the need to step up as a caregiver or respond to a crisis can strike at any time. The COVID-19 pandemic has forced all of us to face the possibility that this could happen to us. Since 2020, many people have become caregivers for the first time, and half of those have become caregivers because of COVID-19. Even people who are already filling that role as providing care to a family or friend have been affected as well. Nearly half of family caregivers are reporting that their caregiving responsibilities have increased because of the virus. Being a family caregiver is one of the most important jobs a person could ever have. It's also one of the most challenging. The role can be frustrating, satisfying, exhausting, joyful, thankless, and everything in between. AARP has important, easy-to-use resources and tips for caregivers. Let's hear more from our next speaker, Ms. Veronica Segovia. Ms. Segovia is the Senior Advisor at AARP, and she works to impact lives across areas that matter most to Latinos and their families, health, wellness, and fun. Or as her team says, salud, dinero, y amor. In her role, she applies more than 10 years of experience in digital, social, and mobile communications to reach consumers on key issues of health, security, and financial resilience across key channels. Welcome, Ms. Segovia.
Thank you so much. Thanks for having me here today. So I wanted to start off just sharing a little bit about who AARP is for those who might not be familiar with AARP. AARP has been working to promote health and well-being for older Americans for more than 60 years. And in the face of the coronavirus pandemic, AARP is providing information, advocacy, and resources to help older people and those caring for them to protect themselves from the virus, prevent it from spreading to others, and to help them cope with the health problems and financial disruptions caused by the virus. So you can find coronavirus resources from AARP at aarp.org/coronavirus and in Spanish at aarp.org/elcoronavirus. So I just want to share a little bit about caregivers and caregiving in general. AARP has done studies. I'm happy to see the National Alliance for Caregiving on this call. We put out a caregiving in the US status research last year that really showed us that family caregivers are an essential part of the social, health, and economic fabric of the United States, and that caregivers provide an economic value of $470 billion in unpaid contribution to taking care of folks. So even in ordinary times, family caregivers undertake a daunting set of tasks, one that Christina mentioned earlier. In the face of a pandemic, these responsibilities have expanded and become much more complicated. And so I want to go ahead to the next slide and just talk a little bit about some caregiving tips to stay prepared, especially during a pandemic. Since the pandemic began, AARP has fought for up to $1,800 in direct payments to help those struggling to afford to pay for food, medical bills, and other basic needs. AARP has also worked to ensure that individuals who are working, unable to work, or are unemployed, or maybe retired, can receive direct payments. AARP's advocacy was essential in ensuring that the Social Security and Medicare trust funds will be made whole as employer payroll tax payments are delayed due to the crisis. I wanted to share a little bit as well that AARP is also advocating on behalf of older adults to fight for increased funding to improve safety for those most at risk of the virus and to better protect the health and safety of residents. AARP is fighting to save lives and protect nursing home residents against sickness, neglect, and isolation during the COVID-19 pandemic. AARP is also fighting for older Americans to be prioritized in getting the COVID-19 vaccine. AARP has fought for more investment in the vaccine so that people who want it can get it. AARP has also supported billions of dollars to achieve a more transparent and effective vaccine rollout, with hundreds of millions of dollars for high-risk and underserved populations. Americans who are unable to work or who are losing their job, AARP is also working to strengthen and expand paid sick and family leave, so that, as well as unemployment insurance, so Americans who cannot work due to the coronavirus have some relief and support as well. AARP is also fighting for access to more affordable and accessible high-speed internet to help people work, learn, or get medical attention at home during the pandemic. And we're also fighting to help vulnerable seniors put food on the table through advocacy around SNAP and food insecurity. So I want to just share some tips from AARP, and that is, if you are a caregiver, to stay home if you're sick and practice social distancing. Remember that those who are over 60 years of age are at a higher risk. We need to rely on each other for mental, emotional, and physical support. So to be supportive of folks who are in a caregiving role. If you are in a caregiving role, to be sure to manage and take stock of essential items in your home and medications if you're a caregiver. That's something also that's very important to keep track of, is the medications and the levels and when you need to reach out to a doctor or to the pharmacy to get more and to make sure that you have everything you need. Also, don't forget about yourself, right? So find ways to stay connected, even though you may be apart, finding ways to connect via technology. AARP has recently acquired an older adult technology services, otherwise known as OATS, that offers technology education in Spanish as well. So you can check out on our website at aarp.org if you're looking for tips on how to teach someone how to use Zoom or how to use just FaceTime so that you can connect with someone digitally. And most important for caregivers, if you're a caregiver on this call, it's important to remember yourself and that you can't take care of others unless you take care of yourself first. So there are some resources on AARP's website for self-care, tips for self-care, and also some resources if you know a caregiver on how you might be able to give that support to someone or offer something that may be as simple as just a phone call or a text to see how they're doing. Next slide, please. So AARP has also rolled out a lot of advocacy around nursing homes. We know at AARP that a majority of the deaths resulting from COVID-19 have taken place in nursing homes and that is unacceptable. So AARP is doing a lot of advocacy and has done for the past year around nursing homes. If you want to go to the next slide, I just want to walk through, if you do have a loved one in a nursing home or an assisted living facility, there are 8 questions that AARP encourages caregivers to ask when reaching out and inquiring about their loved one's care. Can we go to the next slide? Thank you. So the first question we want to encourage everyone to ask a facility or where your loved one might be is how far along are they in the rollout for COVID-19 vaccinations, not only for residents, but also for the staff. Also asking if anybody at the nursing home has tested positive for COVID-19. What is the nursing home doing? What protection have they put into place to prevent infections? Does the staff have the proper personal protective equipment or PPE? That might be, do they have enough face shields, masks, gloves, etc.? How are they keeping families and patients connected? Very important. I have an older sister in a nursing home in New York, actually, and my father, who's 88, is constantly reaching out and checking in to see how he might be able to see her. And earlier last year, when she had first gotten admitted over there, there was no Zoom. There wasn't an ability to see her face to face. And so checking in and asking facilities where your loved ones are, how those facilities are keeping families connected, what are your options to stay connected to your loved one, very important to ask those questions. We as Latinos know how important our families are in our care and in our progress. So very important to ask those questions. How can you stay connected? Another question, is there a plan to communicate information to residents and families? So we all know there might be a plan for them to communicate things to residents, but it's also important as family caregivers that we as caregivers get that information as well. Also asking if the nursing home is properly and fully staffed is a great question. You want to know, how they're doing with staff. We know that in light of this pandemic, a lot of people and a lot of jobs have been impacted. We want to know that those facilities that have our loved ones staying there are staffed and properly and fully staffed if possible. And then how are healthy living programs being maintained? This is a question that AARP added this year, knowing that depending on the state, every situation is different, but wanting to understand and wanting to inquire, how are they maintaining healthy living practices for your loved one where they are? Making sure that mental health is something that's being addressed and offered support for. So remembering that every situation is unique, AARP does recommend that you as caregivers connect and consult with your own medical providers for expert advice. And I would say if you can, stay up to date with these questions that AARP recommends caregivers ask by visiting aarp.org/caregiving or aarp.org/cuidar in Español. We can go to the next slide. So these are more resources from AARP. I want to make sure that I share them, and then I'll also go into some information specific to Puerto Rico as well. So AARP has been doing a lot of work to connect older Latinos to resources around coronavirus. We've also done some work to connect those who do not necessarily have access to a website, or maybe they're not viewing this webinar, right? There are a lot of us who know someone who is older, or we're caring for someone who doesn't have access to the internet, or who isn't using a mobile device to look up resources online. And so for that reason, AARP still has a phone number. We have a phone number in English and in Spanish for anyone who wants to just hear a friendly voice and talk to someone. We know that isolation has been a big issue during the pandemic, especially with social distancing and quarantine. And so a friendly voice was launched last year. That number in English is 888-281-0145. And then in Spanish, for anyone who could use a friendly voice in Spanish, that number is 888-497-4108. And I believe anyone who participates today is going to get a copy of this deck so that you can see these resources and have them handy. The friendly voice is really, it's really being answered by AARP volunteers and staff to provide exactly what it's called, a friendly voice. And if needed, can connect folks or offer some resources if someone is in an emergency or something like that. But really, the idea behind a friendly voice is just to spend some time with somebody on the phone who might be feeling isolated. So highly recommend that if you know someone who might need it, that I encourage you to have them give us a call. And then the coronavirus websites that we have, aarp.org/coronavirus and aarp.org/elcoronavirus. Those pages are updated regularly every day with the latest and greatest information, credible information about COVID. So that might be about a vaccine. It might be about recommendations for family gatherings now, depending on states that are uplifting some restrictions. There's also information there about our teletown halls. AARP hosts weekly teletown halls every Thursday. And this week we are having a teletown hall around coronavirus and the Latino community. You can get information about how to dial in to that teletown hall at aarp.org/ El Coronavirus, or aarp.org/coronavirus. That event will take place in English, but there will be simultaneous Spanish translation, and we will be sharing information specific to Latinos and the coronavirus, the Latino community in the United States. We also have caregiving resources for caregivers at aarp.org/caregiving, and in Spanish it's aarp.org/cuidar. These are free. They are prepare to care guides, and they have simple 5 steps to follow to prepare as a caregiver. I have an example, so I'll just read to you the 5 steps quickly. You can order this though for free on AARP's website, or you can call to order as well. And NHCOA, our friends at NHCOA have also some copies of this. We often work with them to distribute them. We have these care guides in Spanish and in English. So I'll just share with you a little bit about the 5 steps that we recommend at AARP that all caregivers take. And there's tips in here about how to create a plan if you haven't created a plan. Oftentimes, we fall into the role of caregiving as a result of an emergency. We often don't talk or don't plan as families. We don't sit around the dinner table and discuss family caregiving plans. And so in this guide, we have tips on how to start the conversation about creating a support system for family caregiving, about how to form your team, how to make a plan, how to find support in your local area, and also how to care for yourself. Very important. And there's a list of resources as well in the back with numbers for different organizations that can help and who are supporting caregivers. We also have specific caregiver guides for veterans, anybody who's caring for a veteran, aarp.org/cuidar veteranos in Spanish if you need that care guide. I've also shared a PDF version of the specific Prepare to Care guide for the island of Puerto Rico. The Office of AARP in Puerto Rico does a lot of work on behalf of caregivers in the same way that we advocate here in the DC area and across all 50 states and territories. If you are in Puerto Rico and you are looking and interested in resources as a caregiver, I want to share with you that we do have a specific care guide that I shared with the NHCOA team. If you are participating in this webinar from Puerto Rico and want a copy of that care guide, please reach out to the NHCOA team so that they can get that over to you. It is PDF'd and it's free, so we can send it to you in an email. And then if you'd like it mailed to you, I can work with NHCOA to make sure that we get that done. The other places where I recommend that anyone in Puerto Rico visit are soyaarppr.org, or to check out the Facebook page, facebook.com/AARP Puerto Rico. There's a lot of resources that the Puerto Rico team offers, specifically around the roles and responsibilities, specific roles and responsibilities for those who might be long distance caregiving. We've seen a lot of people in the wake of the pandemic who are finding themselves having to provide care long distance. The family might be in Boston or in Florida and they have loved ones on the island of Puerto Rico. We have a long distance caregiving care guide on our website as well. And then there's also specific tips around preparation, especially during different times of the year when hurricane season is upon us, a list of different preparation necessary in case of an emergency if you're a caregiver, and also some tips around how to just manage oneself and to provide self-care and to find ways to find joy and happiness in this role as a caregiver. And there's also guides specific to planning caregiving with attention and care for older adults who are LGBTQ and specific needs there in terms of being able to provide competent care for folks who are older, who are LGBTQ, and who have needs and just consideration as well. So we have very specific care guides and resources. I hope that you'll all be able to visit them, and that if you have any questions, I'll be on for the remainder of the webinar.
Thank you so much, Ms. Segovia. Now let's begin the question and answer session. Again, if you have any questions for the presenters, please write them in the chat box and we will address them. Our first question, I believe actually is for you, Ms. Segovia. How has AARP advocated against ageism in the job market, particularly in an economy that has been racked by COVID-19?
So actually, that's a great question. AARP has an entire team focused on work and jobs, and specifically around age discrimination. So ageism, the protections around ageism kick in once someone turns 40. So that's what the federal protection kicks in at, is if you are 40 and older. And AARP has been doing a lot of advocacy, particularly around not only discrimination, but they've also been doing, we've been doing research. So we did an entire media tour in January this year that talks and highlights you know, the 50 plus older worker, and how the pandemic has increased the stress and anxiety levels of someone over 50 in the job market. So AARP is doing a lot. In addition to that, we're also advocating that flexible work, paid time off, and other policies that could benefit or support older caregivers could boost our economy. So AARP has found that, you know, flexible work, paid time off, and other support for family caregivers who are over 50 and who are working could add around $1.7 trillion in the next 10 years. We have a job website. I'm not sure if the person who asked the question wants specific tools and resources, but you can go to aarp.org, and we do have a job website so people can look for work. We also host a career fair. It's virtual. We host it twice a year. And part of that career fair work and part of the work at work and jobs is to get more employers to sign on to our employer pledge to recognize the value of older workers and to commit to hiring older workers, so as part of their diversity and inclusion strategies. So yes, and if you want specific resources from AARP around jobs, let me know, because I have access to the studies that we've put out and the content. I don't have it in front of me because I prepared for caregiving specifically, but I can get that to you guys.
Perfect, thank you. And then we've got one other question. This would be for Pedro. Pedro, as you dealt with some of the stressors of caregiving long distance, what were some of the things you did to help with your own mental health? I'll give him a second to unmute. Oh, apparently he is having technical difficulties. So we will provide responses to any questions that we weren't able to answer here in the comments section when we upload the video and the slides to our YouTube channel. Someone asked if the slide decks would be available. They really wanted a copy of Ms. Whiting's slides. Those will be available on our YouTube channel. So before we end our webinar today, we have a few more questions. So if we can go to question number 7, and this helps provide feedback for us. So how useful was this listening session for you? I think we'll give our pollers a second to load the question. And while we're waiting for that, I will thank our sponsors again and thank our experts and attendees for joining us for the webinar. Again, I think you briefly heard from Pedro and some others. Oh, here's our poll. Okay, so how useful was this listening session? You'll have about 60 seconds to respond to this, and then we'll have one more question. All right, 5 more seconds. And then we've got one more question. What's one new thing you learned about in this webinar that you plan to use? And again, this will have 2 parts because there's more than 5 responses. Okay. And then I believe there's a second part to that. There you go. And then if you choose other, if you could please list in the chat box what other things you learned about the webinar from the webinar that you plan on using. Again, thank you to our sponsors, experts, and attendees for joining us for today's webinar. We invite you to participate in NHCOA's toll-free COVID-19 hotline that has up-to-the-minute updated information about COVID-19 virus and how to access the vaccine. Our newly launched hotline empowers Hispanics and Latinos with accurate information and resources to stay healthy during the pandemic. It also assists callers with registering and accessing the COVID-19 vaccine in their respective communities. Callers can access assistance with transportation to get the vaccine also by contacting us through this number. The toll-free number is showing on your screen, and as always, you can look for more information on any of our social media platforms. For more information about today's webinar and our upcoming virtual events, please visit NHCOA's website and social media channels, Twitter, Facebook, and Instagram using @NHCOA. And our website is NHCOA.org. A recording of this webinar will be made available on our YouTube page. Any questions not addressed will be addressed in the comments section. Hope is essential in times like these, but let us remember that you are not alone and together we will succeed. Thank you, and until next time, goodbye.